This Docs on Call is brought to you by Excellus Blue Cross Blue Shield and Guthrie. I'm here with Dr. Benjamin McClintic, a fellowship-trained cardiologist of the Guthrie Cardiac and Vascular Center here in Sayre, and we're going to talk about echocardiography. Doctor, what is an echocardiogram and why might a patient need one?
There's lots of reasons to need one. An echocardiogram is basically an ultrasound of the heart. It uses sound waves to look at the structures of the heart and the function of the heart muscle. Patients may need them to look for cardiac disease caused by high blood pressure or coronary disease, or even to look for other diseases that don't involve the heart. We can get clues to those diseases on an echocardiogram.
And how is an echocardiogram performed?
There's a few different types of echocardiograms. The most common kind is called a transthoracic, which basically the patient just rests in bed and they use an ultrasound probe on the chest wall to take pictures of the heart. We can sometimes do, in addition to that, something called a stress echocardiogram. That's where a patient would have their heart stressed either by exercising on a treadmill or a bicycle, or sometimes given a medication to speed their heart up, and we can see what happens to the heart at stress. And then the final kind is a little more specialized, called a transthoracic a transesophageal echocardiogram. And that's where a patient is sedated, ultrasound probe is passed into the esophagus, and that gives very high resolution images of heart valves, making sure that there's no clots in the heart and so on.
All right. Thank you, Dr. Benjamin McClintic with Guthrie. To learn more about the advanced diagnostics and procedures available at the Guthrie Cardiac and Vascular Center, including echocardiography services, go to the website guthrie.org. For more information, you can also go to our website, WBNG.com. To leave a comment or ask a question, call 584-7362, 584-7-DOC.